Hi everyone, my name is Jaminal, and this evening I'll be introducing you myself, providing some background about my family and how I got here in the United States, and some educational background which I finished prior to applying and currently studying now in the University of New England's Masters in Public Health program. So as you can see, that's me. That's when I finished my degree in biochemistry. But going to the point of in terms of like my family background, I'm the youngest in a family of four. Basically, I have a sister that work. I have an older sister, and she works as a neonatal intensive care unit nurse in the University of Cincinnati Medical Center. Both of us were born in the Philippines, so in terms of getting used to the weather here in the States, primarily when I arrived in New York during the year 2011, there was a lot of adjustments in terms of like coping up with the four seasons here compared to the Philippines, which sometimes it's just summer or rainy season here. You have fall, spring, and many more. And in terms of my educational background, when I got here in the States, I began my journey at Dutchess Community College, where I pursued a associate in science in biology. And from that point on, after I finished that, I transferred to the State University of New York system at Stony Brook University. It's a flagship university school where I was able to finish my degree in biochemistry, and that further increased my curiosity in terms of the natural sciences. But moreover, I was really interested in I got interested in public health when I started volunteering as a community health volunteer in the Philippine Red Cross. And during that time, I was as you can see in the picture. This is when I was in the Philippines. Instead of doing a vacation, I instead decided to devote my time and my effort in helping my fellow countrymen in times of need and disasters such as this one here. This crucial time was when there was a major flooding in my hometown in the province of Zambales, which is in the main island of Luzon. So my province is roughly 5 hours from Manila. So so going back to the picture here, I am basically showing the importance of sterilizing or boiling your water prior to drinking it, and moreover, other times I emphasize on the importance of proper hygiene, such as hand washing, using hand sanitizers, and moreover, all of this, the culmination of all what I've been doing in terms of emphasizing proper hygiene and measures in preventing like diarrheal infections by again boiling your water prior to drinking or using it, is to prevent the spread of diarrheal diseases. Because in the Philippines, in terms of like events after major floodings or major tropical storms, the water source of the of the people like in affected areas are sometimes contaminated with sewage water. And that's how the system of that's how the sewage system in the Philippines works. So that's why, through the efforts of the Philippine Red Cross and me volunteering with them, that's that's our part is to inform our countrymen and my fellow citizens in the Philippines to have an appreciation, and most especially being aware that of course, even though hand washing is a very simple thing, it is still very important. Even though boiling water takes away some amount of time in your day, it's still very important to prevent any spread of diarrheal diseases, because mainly the population affected with diarrheal diseases in the Philippines, and particularly in my hometown, are kids and the elderly, because of course we're aware that their mechanisms in terms of coping with these types of infections are not too developed yet compared to a healthy adult. So that's why, in terms of me doing my part, being a community health volunteer, and my part allowing to facilitate the prevention of the spread of their real diseases, that's why I'm that's how I got my passion in terms of learning more about public health, its importance, and its role not only in the United States but most especially in the whole world, and its role in terms of making medicine more efficient and more effective, and it increasing its impact to everyone that needs it. As of now, I work as a associate medical technologist at the University of Cincinnati Medical Center in their clinical laboratory. So basically, I run emergency room lab tests such as measuring troponin values, measuring lactic acid values, and ensuring that all the results that I give the doctors are accurate and within policy. And in the weekends, I volunteer as a lay responder first aid CPR and AD instructor, and sometimes I also teach basic life support for healthcare providers through the Preparedness, Health, and Safety Service of the American Red Cross. And in me working in the lab or working in a hospital setting at the same time volunteering, it gives me the best of both worlds. In terms of working in the hospital, it exposes me to basically how the importance of having working in a level 1 trauma center basically grants people that don't have the benefit of having their own insurance, medical access, and medical care. So that's how I got exposed with that regards to like EMTALA, and that's why I appreciate in terms of its contribution to helping people that need medical care. But at the same time, it also exposed me to how people sometimes, since they don't have access to preventative care, and their condition escalates to a more serious condition, that's why they end up in the emergency room. It shows me the importance of having levels of care prior to getting emergency care. And this is with me exposure with my other classes in UNE, such as like introduction to public health and policy, and I really like that class. So in terms of that exposed me, so basically taking this class, public health administration, it's like bridging both of my experiences from that class and experiences here in working at the University of Cincinnati Medical Center. And with regards to being a volunteer instructor, it's showing me that by basically empowering and equipping people with the knowledge they need, they're able to help not only themselves but also the community. That's same with public health, where in terms of public health, the main effectiveness that we have is by informing our constituents, our fellow citizens, our fellow legislators on what must be done. Because in terms of public health and having a effective public health system, and everyone I know that everyone knows this already since we have different class backgrounds and whatnot, that public health is very effective when everyone collaborates. And sometimes, yes, it's ideal that everyone cooperates, but that doesn't happen all the time. But still, in terms of fulfilling in terms of having an effective public health system, that's how it's effective when everyone cooperates and does their part in terms of making sure that any problem is made aware of, a policy, an assessment is done, a policy is developed from the data from the assessment, and that in terms of implementing the policy, making sure that everyone has access to the care and services that's written and entitled in that policy, to assure that, of course, that policy works. So again, overall, that's how I got interested in public health, and that's why I'm taking this class, this public health administration class, is to further my knowledge in terms of how public health administration works in terms of making sure that there's an effective public health system. Again, it's my honor and pleasure being your classmate, and I do hope that throughout these 8 weeks, even though it's very short and fast, that I can know all of you, and that we can share all of our thoughts and our insights, so that all of us I mean, not just me, but all of us can benefit from this class, and hopefully all of us become a successful public health professional. Again, it's my pleasure introducing myself. I humbly apologize for slightly stuttering. I do 16-hour shifts in my job in my hospital at the same time taking two classes with UNE, so that's why I'm a little bit tired. But again, thank you so much for taking your time and taking time away from your busy time in listening to me. Thank you so much, and I hope that all of you have a pleasant evening. Thank you.